Is you sell your business, which is in the dating space, for $50 million. And then you pick the hardest problem there is in the primary healthcare business. What's the thing? What was the thought process? What was going on in your mind?
For me, as an entrepreneur, like, you want to solve important problems, and you want to solve problems that have a tangible value in terms of people's lives.
I want to understand you as a founder. Like, when did that really get activated?
I don't think I was ever employable. I was like always at the verge of like getting fired, but also like they love me so they wouldn't fire me. Like, you know, like
you're in a room full of investors and then you're pitching the free product business model. Can you walk us through that dynamic and how did people buy that?
And where we lost most people was when we told them it was free. It's very different. Like when you're not the founder, right? You're like, wow, like life is really easy. Like, you know, like it doesn't have to be that hard. You could just go to work and go home and enjoy your life.
KJ, it's a privilege to have you on Catapult Code. As a serial founder, there's one theme across both of your startups: access for the excluded. So we're looking forward to talking about that, and also talking a little bit more about the outsider's confidence that you bring in building something in the healthcare space, which is intimidating for most of us. So looking forward to this conversation.
Yeah, thank you guys so much for having me. Yeah.
And maybe we'll start with that. I was reading about the thesis. What was a childhood wound or childhood trauma of translating healthcare, translating that into a business build? Can you talk a little bit about the origin story for Lotus AI?
Yeah, definitely. I would say there's always a through line to everything in life. And for me, healthcare was one of those things I was thinking about for a very long time. Like you mentioned, my childhood, I was oftentimes going to my parents' doctor's visits to help them translate what was going on. And then after the fact, helping them sort of navigate all the challenges around American healthcare and in health insurance in particular. And when I was 18, I had actually a sports injury where I had 2 herniated discs. And I was like sort of bedridden for like a month. And then I accumulated all of these sort of like health records that an 18-year-old probably should never have. And I was sort of required to go specialist to specialist to try to get opinions, and they would all sort of make me do the same tests over and over again. At one point, I had a binder of my health data that I would carry around. And so that was, I would say, when the seed was planted, where I was like, there needs to be a way I can aggregate all my health data in one place and utilize it to have more agency over my health. And it wasn't until I sold my last company and the advent of LLMs and AI now, and also the sort of groundwork for healthcare data interoperability in the US sort of came about, which were sort of the 2 major why nows of building Lotus AI now. And but yeah, to your point, it's been a pain point or a thought of mine for a really long time.
And so what does it take? What's the thought process? You sell your business, which is in the dating space, for $50 million.
Yeah.
And then you pick the hardest problem there is in the primary healthcare business. What's the thing? What was the thought process? What was going on in your mind?
Yeah, you know, we just hired somebody today, like a researcher who I went to lunch with, and he was asking me the same question. And I think it's really, for me, as an entrepreneur, like, you want to solve important problems, and you want to solve problems that have a tangible value in terms of people's lives. And for me, I've always loved consumer because I felt like that was the best sandbox for me to try something and then see the immediate impact on the people around me and people in my life. And with Dil Mil, it was very much like, my sister was single at the time. She was a doctor and, you know, just a highly qualified person, but just was having a hard time finding somebody. And then a lot of my cousins were in this same sort of problem set. And then I was like, this is a really good problem to work on, because a lot of people are single and they're struggling, and this is maybe one of the most important decisions they're going to make in their life is, you know, who they fall in love with and who they marry. And at the time, as you guys might know, there's a website called shali.com, which wasn't doing that great in terms of really matching people, at least in the West. Like 50% of their users were people's parents. And so I was like, all right, there needs to be a mobile first sort of UI UX that is easy to use and sort of like first for the actual user, not for the parent. And ended up sort of building Dil Mil out of that sort of perspective and helped millions of people find love. And after I sold the company, it was really, okay, this is something I've done that's useful for the world. And like, what can I do now that's even more useful and I can see myself potentially spending the rest of my life on? It was really, health was one of those things I had thought about for a long time. And now it kind of hit me. It was like, what other problem to work on than human health or just helping people live longer and live healthier lives. So to your point, yeah, I mean, it's a little bit of a crazy thing to do, but I think it's also like, I always say to founders where, you only get like 2 or 3 big swings in life. And I think it's really important to take those big swings because at the end of the day, most things take as similar or maybe more amount of energy. So why not spend that energy and time on something that's really worthwhile? And if it fails, you're going to end up learning a whole lot more than taking a swing that wasn't consequential in the beginning. So that's sort of my, I guess, insanity.
Go ahead.
Yeah, and I couldn't help but bring the authentic the authenticity from the Punjabi roots in naming Dil Mil the way it is. It's so intuitive.
Yeah.
It's like something you would say, and it's as intuitive as Shadi.com.
Yeah.
And how you brought that to a community that was underserved by other solutions in the market.
Yeah. It was actually called Dil Mil in the beginning it was DILMILE.
Okay.
But 6 months into it, we dropped the E. We made it more cool and hip, like just Dil Mil. But yeah, it was very much, I always have tried to like kind of bring my culture and my roots. And I was born in Punjab actually and moved to New York when I was pretty young, like 4, and pretty much raised in the US. But I've always loved sort of keeping in touch with the culture and identity and the roots, and even Lotus actually. Yeah. So my name actually means Lotus. Huh. So my name's Kamal.
Kamal, okay.
KJ stands for Kamal G.
I should have guessed.
Yeah. And so it's less of like a self-obsessed thing. It's more of this is my life's work and my legacy and my purpose.
Yeah.
So I wanted to sort of name it, but also like Lotus is generally a very sacred plant and flower in a lot of cultures. Yeah. In terms of, especially has a lot of sort of similarities to like just health and rejuvenation and a lot of these things that people sort of think about when they think about their health. So we felt that was a good name. But so yeah, I think we've always been good at naming companies.
Yeah.
Yeah.
In terms of the through line concept, we've talked about the origin stories of what the catalyst of the problems with healthcare or with dating and solving that. But I wanted to understand you as a founder. Like, when did that really get activated? When did you have a sense that that's what the path that you wanted to take in life?
Like just as a founder?
As a founder, yeah. When you realized that you were not employable, I guess is that's my question.
I actually think, that's a great point. I don't think I was ever employable. I was like always at the verge of like getting fired, but also like they love me so they wouldn't fire me. Like, like I was always driving value for the business because I've always believed like no matter what you do as an employee or as a, as a CEO or a founder is you should go all in. Mm-hmm. Something that, my father or my grandfather have always instilled in me. And I think that because of that, like I was always delivering results for every job I've ever had, but I was always like causing trouble as well. So it was like, I was like the favorite student, but also the bad student in the class. But I think that it was probably honestly even just like when I was like 14, I've always been an entrepreneur. Like I was even before that, like probably middle school, I was like selling gum in like school, just trying to make money, like, thinking of like business ideas. And I think eventually when I was like 13, 14, I recruited a bunch of my neighborhood like friends or like classmates to start like a snow shoveling business where we'd go around like shovel old people's driveways, and they would like just out of pity of like these kids struggling to sort of like shovel the snow, just pay us like an extra like $100 or $200 every time we'd like shovel their snow. Ended up actually being a great business every winter, and then I eventually started selling sneakers on eBay and became like a power seller on eBay when I was like 15, 16. I had my whole garage was full of like all these like really cool sneakers. And my mom was like thinking I was like doing something illegal and I was going to go to jail. So she didn't understand what I was doing. She didn't understand that you could buy and sell stuff online like that. Yeah, so I think as far back as I can remember, like I've always wanted to be an entrepreneur and like just love building things and selling products and, you know, services. And that led me to also always like to, you know, wanting to build. So I've always like sort of been good with my hands and, you know, all the sort of aunties and uncles like in the Punjabi or South Asian community in our sort of community would always bring like their computers to me like to fix and stuff, right? So like I've always known I wanted to go into engineering as well, and I think that ultimately that led me to study engineering, but always wanted to sort of like use that to build a product or service and be a founder. So I kind of like, to answer your question, I feel like I've always known. It was just like waiting for the right opportunity in the right time. And by the way, there's a lot of businesses that you guys don't know of that have failed that I've started. So like Dil Mil was, you know, actually prior to that, Union Metrics I was on the early team there, and we built one of the first Twitter analytics tool called TweetReach. And then also built a Tumblr and Instagram analytics tool that ended up doing quite well. We eventually got acquired as well. Before that, there was a bunch of companies I started even during like college and university where like none of them really succeeded, but we learned a lot. But I think that, so Dil Mil was the one that like kind of the first one that actually succeeded, I guess you could say.
What did you change about how you built Dil Mil that led to that success?
That's a great question. I think a lot of it was, so for what it's worth, the other companies were all before I moved to San Francisco. And so that's a big lesson is, you know, team, capital. You know, these are two things that, you know, as a founder, you have to really get right initially. Like you have to, I would say team out of anything else is we just didn't have enough really good engineers or software engineers on the East Coast that were like accessible, you know? And so for me, I've always like tried to surround myself with like-minded people and other engineers that were building things. But, you know, I went to school in Philly and, you know, there was like maybe like 100 people in the whole town or the whole city that were like really deeply into building startups and like, you know, software at the time. And you move to San Francisco and there's like 100,000, you know, so it's just like a sheer number of people that you can access and talent. And that was probably the biggest difference, is I could finally like find the right people and build a product or service and then show enough proof points to be able to raise enough capital, because that's the other problem is, right, on the East Coast, you don't have like capital that's willing to like, you know, take risk, right? You know, riskier capital here. And that's a function of just like, as you know, is just the number of successes that have happened in the Silicon Valley, and the venture capitalists here willing to take bets early and knowing when to take bets on what type of products. And I think that is, I would say even today, is largely missing from the East Coast. Obviously, New York has some glimmers of hope within that, but I would say that was the biggest difference. But then also the accumulation of sort of mistakes that you make and you learn in terms of, you know, and now there's like, you know, there were books about it eventually, you know, like the lean startup and stuff like that, right? But like, I think ultimately you just learn that, you know, you need to move fast and experiment and pivot when necessary, and hire the right team and know when to hire fast. And you know, they say hire fast and fire fast. So like eventually sort of like getting to a team which actually can scale you at the right stage. All of those skills you kind of just build over time by failing. And but I would say that timing is another actually big part of it. I think timing is something that you learn, is you can have a great idea, but if it's the wrong timing, it's not going to work, right? And I think for Dil Mil, it was the right timing because it was early still in the online dating space, and nobody had really built a mobile first experience for a South Asian dating app yet. Like Tinder and Hinge had just got started recently. For Lotus now, I think it's the right timing. We'll find out, but I think it is because, like I said, it's the U.S. sort of healthcare market, which we can dive into in a bit, but you know, is at sort of a breaking point. Patients and Americans in general are really wanting to take ownership and agency over their health. You have this advent of AI, LLMs, as well as health data interoperability. All these sort of forces converging to, I think, creating this like really special moment to start a company like this. But I'll give you an example of a company that I started that failed because it was the wrong timing. But then there was a similar company that started like 5 years later that succeeded, which was we had built a QR code scanning app in Philadelphia. And at the time, like QR codes, I don't know if you guys remember, there was like this glimmer of like QR code hope in like 2010, 2011, 2012.
Mm-hmm.
But then it kind of died out.
Yeah. And
then it wasn't until COVID where like QR codes came back. So at that time, we were building a company which would essentially, it was a QR code scanning app. Like this is when a QR code, you couldn't just scan a QR code with your camera. Like you had to have a special app to do it. And we had built the app, and we actually ran a bunch of pilots in Philadelphia where we partnered with like the Susan G. Komen Foundation, put QR codes on people's sleeves like during the marathon that they do, so you could like scan it and donate to the cause. And they ended up raising like a few $1 million through it, but it was just like Philly. The only fund there at the time was like first round capital, and like they were taking very, very like, you know, low risk bets at the time, and ended up not being able to raise for that company. But then like 5 years later, a company called Scan came out and like got acquired by Snapchat for I think like $500 million or something,
Yeah.
but the same exact product.
Yeah.
So that's when I learned like very early on, like timing is really important as well.
You mentioned two things, pivots and timing. And
Yeah.
so the biggest decision a founder takes is starting the business, and the second biggest is selling the business. So how and what was the process in deciding to sell Dil Mil?
Yeah. I know. I've always believed that. I think that you never want to build a business with the intention of selling it, right? Because if you do that, first of all, you're probably not going to succeed at selling it. I think it's kind of like fundraising. Like you always want to fundraise, like when you don't have to fundraise. I think you'll always be able to sell a business when you don't want to sell the business. So for Dil Mil, it was very much, you know, we had this sort of breakout growth. Like we knew we were the leaders in this space. We continued to like pour resources into sort of building the best product and helping millions of, you know, people around the world find love. But we actually got a cold. It was actually a funny story because it was a cold like inbound on LinkedIn. We always would get emails, you know, of like people like, oh, hey, like, are you raising money? Or, you know, like we want to think about an acquisition or whatever. And this one was like very unique. Like it was like a LinkedIn message. And the guy was like, hey, just would love to chat. Like, you know, we're looking to like potentially buy companies in this space or something like that. And I was like, oh, this is probably like another spam mail or something. And I ended up like just giving him my email, and then he sent me like a very like thoughtful email. And I was like, okay, this is actually like someone that's legit. Like they've thought about this space. And it wasn't even the company that acquired us. It was like this consultant person that they had worked with that was helping them like look for deals.
I see.
And then he notified the parent company, which at the time was called Dating Group. And then the CEO eventually reached out to me and was like, hey, we'd love to chat. And then I started chatting with them, and their vision for like what they were trying to do very much aligned with like our vision at Dil Mil. And so it was one of those opportunities where it was, I think, a good partnership where I was able to sell the business, but then I stayed on actually for like almost 4 years.
I see.
And it wasn't because there was like an earnout. It was because the combined opportunity was much bigger because, which is very uncommon, by the way. Like most startups get acquired and then the founder usually leaves pretty quickly.
Yeah.
It was a very unique situation because the founder of Dating Group had never raised any outside capital. Like he had built basically the entire business brick by brick. And at the time when I joined, you know, I was doing almost like 200 million in revenue. And he was like, hey, like and it was mostly like website based products they had. It was a conglomerate of dating apps and websites. And he was like, hey, you bring all this like consumer product, like mobile experience. I want you to come in and run strategy and like just revamp all of the portfolio and like move it to mobile, and we'll take the company public and I'll make you the CEO. Because he like, you know, didn't want to be a public company CEO. And ultimately he had no experience fundraising, right? You know, when you take a company public, it's a large part of it is fundraising. And I was like, wow, that sounds incredible. You know, like at such a young age, I'll be a public company CEO. So we did a lot of great work. We grew that company to about $500 million in revenue, and did all the IPO like prep and stuff, and then like the public markets tanked after COVID, and then I don't know if you guys remember, but the IPO like market just completely collapsed. Like no one was going public anymore. So we're like, all right, well, this is not gonna like work out for us. So eventually like ended up leaving and starting Lotus eventually. But long story short, I think this was a unique situation where the sale was clear because it allowed Dil Mil to continue to sort of realize his vision, but also give me a bigger opportunity to make a bigger impact, and take the skill sets I had built that were just being applicable to like, let's say the South Asian community, but then apply them for all communities, right? That was eventually like our goal. Was we were like, because there's only like outside of the US, there's, like 10 to 20 million South Asians. Sorry, outside of India and South Asia, there's about 10 to 20 million South Asians that are expats. And that was largely our market at Dil Mil. And then it was like, okay, how do we take this model, apply it to like, the Jewish community, or apply it to the, South American community, the Latin community. And so we were starting to build these brands out when Dating Group came and said, hey, we already have thought about this a lot. Like, we'll help you do this. So that's what we ended up doing with that. We took the technology and kind of replicated it across different markets. So it was just a very clear way for us to sort of like, catapult, our growth. Yeah.
I'd love to switch to, or kind of evolve to the Lotus story, and building there, and starting with the build question. Again, what you've built many different companies. You've learned a lot from that experience, scaled them. You now have an AI native business that you're building. What have you brought to this approach, or how you're building Lotus AI, and what have you adapted to the new paradigm?
Yeah, that's a great question. I think the fundamentals are always the same, right? It's like you like I said, you need a really good team. You should be well capitalized especially in today's AI world. I think that ultimately though, like underneath all that, you need to be solving a really important problem that actually makes sense from not just from a business model perspective eventually, but from a pain point perspective, right? I think a lot of that's, especially in consumer, right? I think a lot of what you see consumer are just kind of like aspirational ideas that people are creative and they want to try things. But when you ask the average person how this like impacts their life, they usually don't have a good answer. And I think those things are like fundamental, and those things don't really change, right? Building an AI native company, the biggest difference is now you have sort of this ability to almost like, I always like to say like democratize like access to expertise, right? And so that's like the biggest thing we're doing if you think about Lotus, right? Which is it's taking sort of this like medical, deeply sort of complex space and distilling it for the average person. That technology now allows us to sort of start to chip away at like if you think about the traditional healthcare stack, right? A lot of it is like complexity at every layer, because a lot of it is rightly so, right? Because you're dealing with people's lives and the risks are really high. But some of it is just because someone figured out that this is a business, a B2B layer within healthcare that makes a lot of money, and we don't want it to change. And we don't want anybody to ever know that there's inefficiencies at this layer, because healthcare is so convoluted and complex. Yeah. Like that's actually one of the biggest things I've found to be interesting is so American healthcare is a $5 trillion market, $5+ trillion market now, which is 20% of US GDP.
That's bigger than India's GDP.
Yeah, it is.
Isn't it?
Yeah,
isn't it like
almost there, yeah.
4 trillion for all of India?
Yeah, 4 trillion.
Yeah, bigger than India's GDP. Yeah. And think about that. Like,
wow.
Bigger than the entire country of India's like economic output, like is just healthcare in the US. Right? Yeah. So it's like you would imagine in that kind of like, market in the US, like everyone should be like super healthy. Yeah. Like we should have the best healthcare in the world, like, like super proactive and preventative. But it's actually quite the opposite. Yeah. Like the life expectancy is actually the lowest in the US compared to all the developed nations. And it's continuing to fall. Outcomes are really bad. hospital systems are overwhelmed. They're being sort of consolidated into private equity sort of holding groups now. A lot of community hospitals have been like basically going bankrupt and shutting down. So really, the reason why all that's happening is because the current sort of fee-for-service model is really set up for sick care. It's whenever there's a catastrophe or whenever someone gets really sick and they need care, they can go to the hospital and get really good care. Like that, I will say, like when you compare to countries like India or just any country in the world, like the US is the best country in the world if you get really sick, right? Like they will make sure they keep you alive.
Yeah.
Right. But the problem with that is like oftentimes that's too late for people.
Yeah.
And what you really want is a proactive system that has world-class primary care, world-class preventative care. And that doesn't really exist today because, and we can get into this as well, which is like because the business model of healthcare is all built around sick care and fee-for-service model. And I think that fundamentally in that model where you have three parties, right? There's a payer, which is an insurance company, the provider, which is the hospital system or the doctor, and then the patient. In that model, the incentives are majorly misaligned, right? If you think about it, because the doctor and the providers only really make money when you get sick because they can bill the payer, and the payer is always trying to minimize how much the providers can bill, and they come up with concepts like prior authorizations and stuff like that.
Yeah.
Right. And then the patient's always, left holding the bag because they're just like, wait, like I pay my monthly premiums to this insurance company, but whenever I need care, I end up with this like fat bill at the end of it every time I seek care. So next time I'm just going to try to figure it out on my own and end up going to like Dr. Google or ChatGPT now, right? And that can't really like actually provide care. But to like ChatGPT's benefit, like it's helping a lot of people as well. You can upload your blood test now and get a pretty good analysis of like what's going on, but it can't close the loop. Like it can't actually give you the prescription or diagnose something or like refer you or order a lab, give you that next step. And that's really where Lotus AI comes in, is because we can close that entire loop, right? And we do it in a way that actually solves that sort of problem, those misaligned incentives, because we're fully aligned with the patient. And that's why when we started building Lotus AI, it was really, how do we build like for the patient outside the traditional system? And the only way to do that was to keep the product free, but also go direct to patient and like a B2C product versus, try to integrate through a hospital system or an insurance company, which, there's countless examples of that, that doesn't work. Yeah.
I'm a cap table guy, so my product forces me to think about fundraising. So you're in a room full of investors and then you're pitching the free product business model. Can you walk us through that dynamic and how did people buy that?
Yeah, that was always interesting. I think the first hurdle was like you brought up earlier, which was this guy has no background in healthcare. Like, what is he doing? I think once they talked and they got to know what we built and they actually used the product, they were like wowed. And that hurdle was usually crossed. And then where we lost most people was when we told them it was free. And I think that, I think, so to my surprise though, the best investors in the world, this is actually where I think this is where like the best investors and the average investors differentiate, is the best investors of the world, like they got it right away. Like they didn't need a lot of convincing of why it's free. Because I think they've funded a lot of these successful consumer companies that didn't make money for a really long time because it has the capital. And then B, because I think they have that sort of like long-term sort of thinking, which is if you think about the biggest companies in the world today, like technology companies, they're consumer internet companies, right? Like you look at companies like Meta or Google, right? And even like products like WhatsApp, right? I mean, again, it's a Meta product now, but WhatsApp, I think now is finally starting to monetize a little bit, right? But they have billions of users, right? But now they're going to be potentially able to monetize a lot. And I think that's really where we wanted to sort of build like a consumer internet company in healthcare. And when we told people that, they got it right away, right? And I think that's kind of the really, it also turns out to be the only way to solve the incentive problem. Because otherwise, you're sort of, if you're making money from providing care to people, your bottleneck is always essentially how much care you can sort of like, provide from an ROI perspective that makes sense for what you charge the, end customer or the payer, right? And that incentivizes less utilization, right? Meaning, like, as a patient, if I have to pay for something every time I have a problem, I'm probably going to only use it a couple times a year or whenever I get really sick, which is how healthcare looks like today, right? Like, you're not going to, if you, let's say your arm's hurting right now, you're probably not going to go to the doctor. You're just going to be like, hey, it's probably fine. Like, I'll check Google, see, or ChatGPT, see what it says, right? But in our model, because it's free, every question now comes to Lotus because why not, right? It's going to give you the best possible answer because it's grounded in all of your health data and all the latest evidence, and it's free. So that actually encourages utilization, right? So, and then because of that, the engagement on the product starts to look like a consumer internet company, right? We have people that use the product multiple times a day, right? And so that really is unheard of in healthcare, because who would think that you need healthcare multiple times a day? But it turns out health happens every hour, every second of your life, and people have a lot of questions. So it's no surprise that ChatGPT has 20% of their traffic is health questions, right? So because it's free, it actually encourages the right behavior, and that's fundamentally important to the business model that we'll eventually build, which is things like advertising, things like triaging into specialty care, even just like value-based or like employer-sponsored healthcare partnerships. And so I think those are three sort of like low-hanging fruits, but it turns out if you just do the right thing and you help people be healthier, there's an infinite number of ways to monetize that.
Did I get this right? Just double clicking on this a bit more. The doctor in the loop is a design choice, not a default or a constraint. Or was there a regulatory angle to?
That's a great question. Initially, we asked ourselves that question very deeply too. But I think the design is right now, it was very intentional to keep the doctor in the loop, because, well, there's a couple of reasons. I mean, one is like, it's just from a safety perspective, I don't think models are completely there yet, right? Even though like we might have some of the best clinical models now, like we're continuing to improve them. Two is like just a regulatory, not even just like a federal regulatory reason. It's just medicine is regulated at the state level.
Yeah.
And I don't remember the last time all 50 states agreed on anything, right? So I think that ultimately, like in our view, like it's going to take a very long time before AI can like autonomously fully practice medicine. But if that does ever happen, like, we will have the data to do it safely. Right. And that's kind of like the promise of what we're building at Lotus, is we're at the frontier of that. Because every single patient interaction, every single physician interaction is a data point that could be used to improve the safety and the accuracy of the clinical output. So that's really what like we're building today. And we always like to say we're building like a Uber today, right? So we have patients who are the passengers, and then the doctors that are the drivers. And it's we're basically hiring doctors across the country, and we're finding passengers across the country and sort of matching the two. Eventually we'll be building a Waymo, right? Where it's like the passenger guides the car, like they have agency over their health. They just, kind of drive the car. And then you have the doctor, like the support person, making sure the seatbelt is on. They'll like chime in and stop the car, like if things are going off the rails, right? So that's sort of like where I think the future of like healthcare looks like from an AI perspective, but I don't think we're fully there yet. So we're just building the sort of the rails and the foundation for it today.
You mentioned agency and agency around the customer, the patient. How do you preserve a sense of agency when you have somebody who can come to a system and it solves everything for them? So I think of the paradigm of AI, I think of, we have, the last couple of decades was really around capturing attention, selling that attention to the highest bidder through the advertising model.
Yeah.
With AI, we have agents that can make choices for us. And so in this case, building agents that can go make choices on our healthcare, which doctors that we actually go and see, even the decision tree of what we want to do. And so you're building this trust with, and a lot of data, where it seems like you can move away from the fee for service in many respects, or opportunity to do that, and more of this almost outcome-based healthcare that you can start to deliver. But you're entering the system of with the different fiefdoms that you're disrupting, to just the mechanics of how healthcare is delivered in the U.S. And how do you think about maintaining that agency for the customer when you have so much pull from these other forces?
Yeah, that's a great question. I think first of all, the reason again why it's free is so we can align our incentives with the patient, right? But eventually, like to your point, the product has to make money. And when it comes to agency, our view is like, in order to help people, like we need to build a business that's like sustainable. Obviously, eventually it makes a lot of money, but it needs to be patient-led care for themselves, right? Eventually. Today, it's physician-led care for patients, where physicians are sort of guiding the agents and Lotus to sort of give care to the patients. But what we're like betting on, and what my vision of the future is if you think about it, like I haven't met any person that says like, I don't want to be healthy, right? But you'll often hear in the US is, healthcare is just too hard, right? Like I don't know what the doctor says to me when I go and visit them for 15 minutes. By the way, after waiting 3 months, and paying like a $50 copay, I meet with the doctor for 15 minutes. And oftentimes it's like half of the time it's not even a doctor, it's like a PA or a nurse, because we don't have enough doctors.
Yeah.
Right. And then after the visit, they're just like thrown into this like whirlwind of follow-ups and potentially testing. And there's no one really like holding their hand and guiding them through this. So most people kind of just like give up, and that's actually where they lose most of their agency when it comes to their health. And we're actually automating a lot of that, but also the biggest thing we're doing is we're giving, and maybe I should talk about this a little bit, is like when you first sign up to Lotus, one of the first things we do is we aggregate your health data that exists in all these silos today, which the reason why it exists in all these silos is because each of these health systems, their business model is try to retain you as a patient or a customer, right? And they don't actually want data sharing to really be that easy, because then it lowers the switching costs, right? And but now, because they're our patient, we can go and request all this data on their behalf, right? And so we do that as a first sort of mechanism. Like when you first sign up, we ingest all your data, and it turns out like that data is super messy, unstructured. So there's a lot of like ETL we do, a lot of data engineering we do to make sure that data is like structured well, for us to use, for agents to use, for our physicians to use, but also like accurate, right? And that allows us to then start not only like providing better care and automating those parts of healthcare, but also allows the patient to understand their health at a much more deeper level than they've ever been able to, because they can actually ask questions against their health data, right? And that's something they've never been able to do. And that is true agency, is like when you can understand something, right?
Totally.
And healthcare has just been one of those things that, like, as a consumer or a patient, like you've never really been able to understand. Not even just, I'm not talking about the complex like workflows of consuming healthcare, but also just your body and your health yourself. Like the reason why doctors exist is because the average person can't, like read medical textbooks and understand the different functions of the body and how they correlate to each other, right? And what medicines and what therapies are actually good for you based on those data points, right?
The pull of this is so extreme. I mean, take the emergence of concierge medicine in San Francisco, and just the extent to where people will go with that, the price points that they'll pay just so that they have a doctor who they can speak to, who has context, who actually spends more than 15 minutes, who then gives referrals that make sense, right, to that specific patient. And so seeing how the market's responded, having my own personal experience with this, I think, it's very timely. It seems like this is what people want, but also the technology is ready for it.
Yeah.
I think the model is building a lot of trust. And I have a much better sense of how you're planning to preserve that sense of agency longer term, because I think, that kind of ties to, I think you've obviously thought very deeply about this problem, not just from the herniated disc in high school, but also you've done a very effective job of surrounding yourself with tremendous capital, not just in the amount, the quality of the investors. And I was hoping you'd talk a little bit more about your thought process of who you surrounded yourself with that capital to help really realize the mission that you have.
Yeah. Thank you. Yeah. And I think there's, one other thing I'll say before I answer that question, which is the data we fundamentally believe the patient owns. And how giving them agency over their data is like the core of what we're doing. And we believe that the patient will allow us to monetize that data if they see enough value in the product. Because ultimately, that data will help them get better treatment and better care, right? And so that's closing the chapter on the agency stuff. But ultimately, like to your next question, I think that being a serial entrepreneur and a repeat entrepreneur, accessing capital becomes a little bit easier, especially if you have a successful exit. But I would say that this time around, it was really important for us to partner with investors that understood healthcare, but also understood consumer and sort of what we were building. And so our two major investors are Kleiner Perkins and CRV. And the partners there are incredible people. We work with Mamoon and Annie at Kleiner Perkins and Sar Gur at CRV, who have invested in, several.
Some of the greatest investors in Silicon Valley. So,
And it was incredible, just working with them, and because they got it, when I pitched them. And it was funny, to your earlier question, it was some of them didn't require a lot of convincing. What they wanted to make sure was I the right person, right? And was I the right founder? And that was more important. And that's when, to your point, if I can sit here and talk to you for 10 hours about healthcare, I could probably do it and be excited about it, right? Because it's something I think about every single second now. I think that outside of them, it's been other great angel investors that we've brought on that have deep domain expertise of either being builders in healthcare or even on the government side, people that have worked at HHS, and different parts of the government where they've tried to impact healthcare. What I found is there's this large group of people that are truly trying to innovate in healthcare or have tried to innovate in healthcare because they care about the patient, but they've had a hard time because they've all took the similar path, which is innovate for health systems or innovate for payers, or figure out some sort of government program that they can sort of latch onto, whether it's Medicare or Medicaid, right? And the problem is, again, I think because the current system of current payment model of healthcare has just been broken, it just was the wrong way to start the businesses. But we've been fortunate enough to be connected with a lot of those folks and learn from them. And then on the flip side, you said concierge medicine, by the way, which is a great point, which is when we first started, we used to kind of say, hey, we're free concierge medicine, right? But the problem is even in concierge medicine, you're limited by the time of the one or two doctors that are the concierge doctors, right? So even they, by the way, are now looking for AI because they want to scale up their time, right? Otherwise, they can't go past a few thousand patients because they need to be available all the time, texting them middle of the night, right? Whenever they have a problem, because otherwise they're not going to pay them $20,000 a year or whatever it is, right? Yeah. And obviously that's not feasible for the average person, right? Maybe if healthcare was a $50 trillion market in the US, we might have a chance, but that would be insane, right? So I think that ultimately, I think the capital and the partners we have, we're very fortunate because we've been able to learn from them, but also, be able to ideate with them in terms of what the future could look like.
KJ, you talked about what Kleiner and CRV saw in the problem in investing in you. You also talked about the fit with the problem, their understanding of the problem. What are the other traits you would look when you were picking investors?
Yeah, I think it's very much investors that are long-term thinking, right? I'll give you guys an example. One of my investors is a Jerry Murdoch. He's the founder of Insight Venture Partners, or Insight, and he's like not at Insight anymore now, but he's lives like in various parts of the world. But he was like, don't pick an investor that is going to build their career off your back, right? And I think like, that was, and at the time I was like, what do you mean by that? And then I thought about it and I was like, it makes a lot of sense, right? Because when you're building a company, we always say like, our goal is, we want to build a multi-trillion-dollar company, right? And so the decisions that we're making today are really like, what does this look like in 5 years, 10 years, 20 years versus like, like how do we get to $1 billion valuation, just so I can call myself a unicorn founder, right? Like that's not really the focus right now. So, and similarly, I think that's a lot of the focus for the young VCs, right? That really haven't had huge exits yet, because for them, like they want to mark up their deals as fast as possible so they can go raise the next round, the next fund, right? And tell all their friends they invested in this company now that's worth $1 billion, right? Versus you have people like Mamoon or like Sar that have like, scaled multiple companies to hundreds of billions of dollars in value. And for them, they're not looking for that like check mark anymore. Like they're looking for a generational company that they can help build. I would say that was one of the most like important things I looked for.
Yeah.
And I think outside of that is just like simple things like character, right? And just like, is this person fun to like work with, right? Or do I feel weird like if I just spend an hour with them,
Right.
Because we're gonna be spending a lot of time together, probably for the foreseeable future. So
those comes back to incentives in the relationship. Basically.
Yeah, I think that's really important. I mean, I always say like you should never work with, like you should always enjoy the people you work with, right? Because otherwise, like what's the point of life then, right? Because most of our time is spent working, and if you don't enjoy the people you work with, it means you're not going to enjoy your life.
So as you think about building out Lotus AI, and you've built companies several times before, how have you approached the actual building of your company and teams, the process of making decisions within that company?
Yeah, that's a great question. I think some of the fundamental things are the same. Like, you want to give people autonomy and agency over their work, and you want to motivate your team properly. You want to build the right type of culture. But I think when it comes to like processes and using AI in terms of increasing our productivity, that's really where I think it's different. We've of course, we're an AI native company, but my engineering team is individually all amazing engineers. But now with AI, they're like, I like to say always they're like, before AI, they were each like 100x engineers. Now they're like 1,000x engineers, right? Because they will have agents running overnight and wake up and have like, 30 PR requests in the morning to review. Right. But so I think like coding and writing code is no longer going to be the hard part. Right. And it already, like I would say the models are already there. If not, they will be there in like about 6 months, where almost, like there's going to be no human engineer that can code better than AI. It's more of orchestrating the architecture and the system and the design, and then being able to evaluate that and how that impacts like the long-term sort of vision of what you're building is really where I think the alpha is moving. Right. For us, we spend a lot of time thinking about like, why are we building this feature? And then, how are the architectural decisions going to be consequential for the rest of the system in terms of how we scale? Lucky enough, we have a bunch of people on the team that have, some of the team actually members were at my last company. So we've seen the pains of like growing to millions of users and things breaking. And it's hard to like tell an AI model like, hey, build a system that works well for a company that has 10 million monthly active users, right? Like it really hasn't experienced that before, right? And I think that while it can maybe infer some of that information, but like, it doesn't really know what things break, and that's where experience comes in. So I think that part is fundamentally changing. But then even just like project management and like, managing like the flood of information as like a CEO myself, like, there's messages being generated in email and Slack and in Linear and Notion. There's all this data being generated on a daily basis. Like, how do you keep up as a CEO and a founder? Like I've built tools myself that just help me like ingest all that data and like synthesize it and come up with a very clear like next action items that I need to be focusing on, right? Because at the end of the day, like I've always believed this with technology in general, which is I think technology either makes your life more convenient or it makes you more productive, right? And AI kind of does both. Right, and it makes you more productive, and meaning you can do more work in that same hour or 12-hour period than you were able to before. But you can actually do it, not feeling like you're burning out because you're able to sort of offload a lot of the actual like manual stuff that you would have to do if you were to read all your inbox and your Notion and Slack messages, right?
Yeah.
So I think there's so many, like, it's a fascinating thing is everyone on the team now is building, right? Like everyone from obviously the engineers are building, but my AI research team is building, my marketing team is building, right? Everyone's building technology now, right? It's kind of this like era of like in the beginning of like, modern day computers and computing, people were building SaaS businesses. And like, there was always this concept of like, do we build this app internally as a business,
Right.
or do we like buy it, like externally, right? Build versus buy debate. Now it's like, does my like marketing guy build like all of this, like the entire marketing stack himself, or do we go like buy it from like these software vendors, right? And sometimes it makes sense to buy still, right? But I think increasingly, like as we go month by month, like we sometimes look at our bills, we're like, why are we paying like $20,000 for this thing? Like we could just build it. We build a better version ourselves. Like, like one of my guys can build it in a week and then we can maintain it every 3 months, right?
Yeah.
So we've actually been able to cut a lot of our costs that way too. So I think it's an incredible time to be a founder and building a company because you can actually do a lot with such a small team now, right? And I've always believed in like small teams. That's actually one thing that hasn't changed, I would say, is even at Dil Mil, we were like a 10-person team for a very long time. We were, even when we hit like millions of users, like we eventually, I think the max team size was like 15 before we sold the company.
Wow.
And I know that's like unheard of in India, right? Like you have like 300 people teams, right? Like for like compared in the US, like 10-person team. I think now, you can have a 10-person team and be running a multi-billion-dollar company, right? And I think it's already happening, right? We're seeing it with like some of the breakout AI companies, but I also think that that also means that the average company now, the faster they can adopt these AI sort of workflows and processes, the more progress they can make, the more money they can save.
Yeah.
And just on the teams and alignment bit, the users or the users on the platform, the doctors are a tribe, your AI engineers are a different tribe.
Yeah.
How do you get them to empathize with each
Yeah. We've been lucky that, because the problem that we're solving is so important, and in terms of like everyone that's joined our team is very mission aligned, right? I think that goes back to like some of the things that don't change, which is like you build a good culture. Everyone is sort of always thinking of ideas on how do we make the patient experience better? How do we make the doctor experience better? And it turns out like actually, to my surprise, like a lot of doctors like really understand the opportunity with technology and they're adopting AI faster than I would have thought. The doctors are building things actually too. I usually have like every week, at least once a week, I have my doctors and clinicians like will bring me like some project that Claude Code helped them build, right? Because they're like, hey, I prototyped this thing. What do you think we should build it into Cortex? So Cortex is our like physician-facing tool. It's called Lotus Cortex, and our patient-facing tool is called Lotus AI. But so I would say like, we hire some of the best people. They're all very smart. So they're all able to adapt and work well with each other because the common goal and the mission is very much aligned, and it's very clear, right? I mean, it goes back to, these are things like you learn as in leadership, right? Which is like, you need to be very like clear on what your company's goals are and like what you're working towards, right? Because otherwise everyone's rowing in a different direction. So I think thankfully we've been able to do that well, and everyone's fully aligned. So we haven't had any issues with doctors working with engineers. I don't know, is that a common thing that you?
Yeah, I mean, they're just different tribes. So it's a hypothesis, but sounds like
maybe we haven't found those doctors yet. We've been lucky to find the doctors that are technologists almost.
KJ, how would you, what did you have to change about yourself in the journey from Dil Mil versus Lotus AI?
Yeah, I was giving this. I was talking to. I was doing another interview. I was talking to someone about this, and I thought about it more. And it was, I think, like when you're building your first sort of thing, which hasn't really succeeded yet, you have a lot of this fear around, what if this doesn't work? I'm going to look stupid, or I'm going to lose all this time where I could be, like I could be a banker or be on Wall Street and building my career up. And this time around, it's like, what if it like works? Like, will I have enough time for my family? And, I'm not even married yet, I'm single, but like eventually, like if I'm married and I have kids, I will have time for them, right? Because something like this can consume the rest of my life, And so I think you kind of have to just like figure out I think all founders are sort of borderline insane, right? Because you try to do something, like I think Reid Hoffman has that saying, right? You're jumping off a cliff and like trying to figure out how to fly on the way down, right? And I think that like, but I also feel like it's like the only thing that makes us happy, right? And as a founder, like I learned this the hard way, which was I sold my last company. Even though I was there for 3-4 years at the parent company, it's very different. Like when you're not the founder, right? You're like, wow, like life is really easy. Like, like it doesn't have to be that hard. You could just go to work and go home and enjoy your life. I think that, but then eventually like you just, like a part of you is just not happy, right? And you start realizing that, and you can start, I started traveling and, hanging out with friends I hadn't seen for a long time. And especially when you make a little bit of money, right? You're like, you have all this time and now money as well, and you can kind of do anything. And you're kind of just like, wait, like I'm like deeply unhappy, and the reason is because I'm not in the grind, like building something that I'm like, passionate about, right? I think your work gives you a lot of purpose in life. And without purpose and identity, you're kind of lost as a human, and I think that for founders, that's like probably the most intensified, versus anybody else. But yeah.
Well said.
Walking away from an opportunity to coast and to picking the hardest problem there is really inspiring. Thanks for your time today.
Thank you so much.
Thank you,
guys,
KJ. It was a lot of fun.
Thank you.
Yeah, thank you.